Mayor Pete Buttigieg of South Bend is now a darling of the establishment, uh, especially now after he openly attacked single payer during Tuesday night's Democratic debate. Now, he's facing a lot of criticism from that, as well as praise from establishment media. So now, during this debate, what he did is that he ended up using right wing framing and talking points in order to attack Bernie Sanders' single player healthcare plan, right? So now, for example, he repeated the oft repeated lie that Medicare for All would kick 150 million people off their insurance. So, 150 million, that'd be about half the country would lose their health insurance. That's a pretty big claim. And of course, it's not true at all. So now, um, whenever they say that too, by the way, they don't say that it's going to be replaced by insurance. No, they're just going to take away your insurance, and that's it. You won't have any. You won't have any. So that's one. Another talking point is that it's a tax on the middle class. Now, look, right now, healthcare premiums are actually also considered or should be considered a tax on the middle class. Okay. Uh, Now, something that they don't mention is that you will have premiums, copays, and deductibles eliminated, and you will save much more money. This is according to all the studies, right? Another talking point is that it takes away choice from people, which I think is pretty absurd. Um, and so, again, he basically, when he was on the stage, presented all these falsehoods as fact. Now, Elizabeth Warren did a terrible job defending herself against that. And then Bernie Sanders, he said, no, I wrote the damn bill, and I know exactly what's in it. You are going to save money. Yes, there will be a small tax increase, but it will be offset by savings. And so, but look again, that's Buttigieg echoing right wing establishment talking points against healthcare reform, actual real healthcare reform that would make a better system. So now, some of the criticisms against Buttigieg came very quickly. For example, in a column on Wednesday, the week's Ryan Cooper argued that Buttigieg's two primary attack lines against Medicare for All, that it would increase taxes in the middle class and cost trillions of dollars, were incredibly misleading. And that's, of course, the other one, is that it costs too much. We can't do it here in America. We can do it everywhere else in the world. We can't do it here in America for some reason. Okay. So now Cooper wrote that it's very obvious why Warren refuses to describe Medicare for All as a tax increase in the middle class. And it is arguably more accurate for her to do so. What really matters here is that while Medicare for All would require some additional taxes in the middle class, those increases would be more than compensated by zeroing out premiums, copays, and deductibles. Buttigieg has claimed that Medicare for All would cost trillions of dollars, and that his incremental plan, which is called Medicare for All Who Want It, or really should be titled Medicare for All Who Can Afford It, would cost less, was also false, according to Cooper. So now, Cooper points out that Buttigieg was likely referencing the study from the Libertarian Mercatus Center about how much additional tax revenue would be needed to finance Medicare for All. That came to about just over $30 trillion, according to what Joe Biden had said later on. So now that gets cited 30 trillion, 32 trillion, 34 trillion. Oh, it's going to cost this gigantic number, the trillions of dollars. And they present that as being added on top of what we already pay. But you got to understand that that's not true at all. And you can't present it in that way because it's absolutely false. Again, Medicare for All would cost $32 trillion over 10 years. That's about $3.2 trillion per year, right? You know what we pay right now? $3.4 trillion a year in our different various healthcare programs. And by the way, we don't even cover everybody. That's the whole problem. That's the whole reason that we're having this discussion on Medicare for All, universal healthcare, is that we have millions of people who don't have any insurance. And then you've got millions of people more who are underinsured in our current system. And the reason, and here's the thing, right? Underinsured basically means you can't either you have a crap plan that doesn't actually cover anything, or you can't afford your copay or deductible, so you don't ever even use your insurance. Disasters, right? So now, again, Medicare for all, universal health care, the spending would go down $2 trillion over a decade, right? Now, those savings would necessarily be less in more fragmented systems, according to Cooper, which would preserve private insurance like every other Medicare/Medicare for all plan that the establishment has come out with, which is basically a public option. Joe Biden has a public option. Buttigieg has a public option. Kamala Harris, public option. Um, and so you're not going to see that kind of savings under a public option than you would for a Medicare for all system. And you would still have private insurance. And I've explained before that the problem with the public option is that you would end up having old to sick people going to that public option and creating a death spiral. And so that's why a government plan is incompatible with private insurance. You just can't have it. And by the way, Cooper also points out that any of these other plans, when they're talking about cost, right, that actually be more expensive than actual single payer healthcare. And this is borne out by numerous studies that put Medicare for all, like I said, at $32 trillion over the next 10 years. Right now, if nothing changes, or if we have incremental change around the edges, our private insurance system would rise to the cost of around $50 trillion by the next 10 years. So now others went after Buttigieg as well. And I've got some tweets here from Representative Ro Khanna. Ro Khanna is a great progressive. He is 100% in favor of Medicare for all. And he said this. He said, the problem with Pete Buttigieg's Medicare, if you want it, is it won't bring down administrative costs of private insurers or maximize negotiation with big pharma and hospitals. And so understand that's where you get a lot of your costs, is that you have pharmaceutical companies that are able to charge whatever they want. You have hospitals that charge whatever they want, especially when you have hospitals that were created for profit. So these are the hospitals that do the surprise billing, that do, that even if you might be in your network, they have doctors in there that see people that happen to be out of certain insurance networks. And so you get hit with that surprise billing, and that's up to you. And so that can end up being a lot of money. So you get these ridiculous networks and in-network, out-of-network BS, along with your copays, deductibles, and premiums. And again, some people's deductibles are sometimes $1,000, $1,500, which means you have to come out of that, come up with that out of pocket before before your insurance even kicks in. And so that's a huge out-of-pocket cost. And so, and having insurance companies and hospitals, I'm sorry, not having insurance companies, having pharmaceutical companies and hospitals being able to negotiate directly with the government, and how much, especially if the government has leverage over them, that will save lots of money. And of course, also eliminating or reducing administrative costs. And that's another thing, right? So now Khanna continues in this tweet. He says, how you pay for Medicare for all would be taxing employers or rich corporations, and at worst, a premium similar to Medicare B. That premium is much less than what Buttigieg requires to pay, but Bernie Sanders and Elizabeth Warren have never used Republican talking points in saying Pete Buttigieg wants to raise taxes. He also said, Medicare for all will be far less expensive because it shaves insurance and administration costs. It's not honest to ask Americans to pay for the system's private insurance costs and a public option gliding to Medicare for all, and then accuse Medicare for all advocates of lowering those costs of raising taxes. Give me a break. Now, he also addressed Buttigieg's claim that Medicare for all would infringe on freedom. Now, where have we heard that before? Again, Republican talking points, right-wing talking points. It's supposed to be a Democrat. Also, supposed to have been someone who respected Bernie Sanders so much that he wrote a column about him in college. Well, not a lot of respect there from what I can see. Now, he said, let's see. Anyone on the debate stage last night who said Medicare for All is about taking away choice is being dishonest. Do they believe seniors over 65 on Medicare lack choice? Bernie Sanders' Medicare for All is about freedom and the pursuit of happiness. And of course, one thing that helps you be able to stay happy is having your health and also not having to worry about if you get sick or get cancer, how you're going to pay for it and how to not be financially ruined by this. So, and he's right. Like I said, Medicare for All, make sure that you are not tied to private insurance through your job. It goes with you everywhere. It doesn't go away. It covers pretty much everything, and it does it cheaper. I know it sounds like magic, but here in America, we're insane. We're used to insane medical costs for things that shouldn't actually cost very much. Like, for example, bags of saline go for several $100s. $1,000 bills for going to the emergency room and getting a freaking aspirin and a Band-Aid. It's complete and utter insanity. And the thing is, in America, we are used to that. I know. While the rest of the world, of course, stares at us as if we're living in the Stone Age. Well, when it comes to universal health care, we are in the Stone Age. And there are people there that are saying, oh, no, we can only do very, very modest reforms. We can go from bashing each other with with rocks to only hitting each other with sticks. Improvement. No, we're not going to do that. No, we need Medicare for All. So now, let me get to the hypocrisy of Mayor Pete. So he attacks Medicare for All, says it's awful, right? Puts out Republican talking points of why it won't work. Yet, not long ago, he might have been singing a different tune. Responding to a tweet here from the People's Summit, which asked, can you affirmatively say that we need Medicare for All now and that insurance does not belong in healthcare? Fairly straightforward question. So this is Pete's response. Gosh, okay, I, Pete Buttigieg, politician, do henceforth and forthwith declare, most affirmatively and indubitably, under the ages, that I do favor Medicare for All, as I do favor any measure that would help get all Americans covered. Now, if you'll excuse me, potholes await. So that's a tweet, not from 2012, not from 2015. No, this was last February. Mayor Pete. Now, to be fair, that was a very snarky / dismissive kind of answer. So, I don't know. You can kind of tell at this point, even though he might have said it, he wasn't necessarily in favor of Medicare for All. It's the guy who wrote the essay on Bernie Sanders. And now that he sees, and by the way, now he's running against Bernie Sanders. And now that Joe Biden is failing as a centrist candidate, well, now Mayor Pete sees an opening. And so this is what he does. He decides to take up the centrist mantle, proving that Mayor Pete is just another politician with zero values. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent, progressive media.